Dental Designers, our location. We got Dr. Hanson with us. Hello, sir.
Hey, nice seeing you again.
It's good to see you again as well. Right off Perryville, by the way. I saw the Chick-fil-A as I was pulling in right over there off Argus. But once you get in here, your office is incredible, beautiful setting. You feel comfortable right when you walk in, and that is key to working on those teeth. But before we get to that, you're a very generous man. You do a lot of giving back globally and right here locally as well.
Right. I have a church clinic that I visit once a week on Wednesdays, and we see patients in the dental clinic in South Barrington.
Nice.
I also have a couple kids that I sponsor, one in Dominican Republic, a little 8-year-old girl, and then a little boy, Ian, in Dominican Republic, Colombia. And he's 6, so that's ongoing. I have India Partners, which helps prevent and help women in sex trafficking, Moody Bible Institute, World Bible League, various, and then of course my home church, State Line, which is right here in Perryville, which I'm at every Sunday.
Yeah, right next door pretty much.
Right.
Well, it's good that you do all that. And let's talk about the practice here. And, you're Dental Designers and really want folks to look into you, check you out. But it's good to start young. Let's bring it in with kids. You like to work with the kids. You love to work with the kids.
We love kids.
Starting them young is key, right?
Right. And we have moms, usually moms are the interested ones, and they ask, well, how young can they come? And my answer is when they have teeth. And so, we see 1-year-olds, we see 2-year-olds, but it's really important to have them come in early. They have a good experience, and then the next visit, they're enjoying
and
it.
that really does put the capital P in preventative too. Getting started young, you can catch any problems that might end up arising across the way, right?
Catch them when they're small. It's a little bit of work, and the kids bounce back.
Seems like a lot of times too for folks who don't go to the dentist regularly, when they do go, it is sometimes a bigger issue that has to be dealt with. There can be some anxiety there.
Yes.
But there are ways around that, right?
Right. We have anxiety on all age groups.
Oh, yes.
So it's not just little ones, it's not middle schoolers, adults, people that have had maybe not the best experience, then they put off dental work and they're apprehensive. And so when they come in, we want to talk to them and we want to tell them we want to help them, but we want to have them be comfortable.
Okay.
And so that comfort level sometimes is just talking to us and getting to know our staff. And then they start to feel like, okay, this is somebody maybe I can have take care of my dental need. Some patients need some nitrous oxide, some patients need oral sedation, and some patients need IV sedation. So whatever their level of anxiety, we try to help that. And usually after a few visits, they're fine without any aid.
And Dr. Hanson, I will remark again on how you feel comfortable here in the office. Had a chance to meet a number of your staff members too, and they're very warm and inviting, and that's key when it comes to your patients, your relationship with them. You do it all here.
Right.
I mean, we're talking everything from the checkups to maybe getting some new designs, some new dental designs taking place, right?
Yes, all facets of dentistry. Patients call, usually emergencies, and they want to get in right away, which is another big thing that we try to be available. When a patient's in pain, they need to get in today. And we do surgery, we do extractions, root canals, all the general dentistry work.
Because when you need that type of a procedure done, you're in pain.
Yes.
You don't want to wait for 3 or 4 days to get in to the dentist to get that taken care of.
Right.
It's good that you're caring enough to make sure that those issues can be taken care of for people. Real quick as we get ready to finish up here, what drew you into being a dentist?
Well, my mom was a registered nurse.
Okay.
So medicine was always in the background. And I think my first dentist in high school was like a comedian. So when you went to him, it was sort of like, wow, this isn't really a dentist. And so then you start thinking of careers, and that sort of led me to dentistry.
Excellent. Well, we're glad you're here.
Yeah.
Dr. Hanson, thank you. It is Dental Designers. You can check them out right off of Perryville. It's kind of tucked back in behind Anderson Hyundai, right across from the Lowe's. And get in here, get those checkups all taken care of. And moms, start the kids when they're young. Thank you,
Early.
Doc. Appreciate it.
Early. Thank you.
Good to be with you.